What's going on, guys? I'm Bill and welcome to Training with Bill. So this is my 4 months post shoulder surgery update. In case you're new to this channel, I'll give you guys a quick background. I had shoulder surgery on my left shoulder 4 months ago due to a labral tear. So a year and a half prior to that, I had been experiencing pain in my left shoulder, weakness, fatigue, popping, clicking, impinging, kind of like a burning sensation and even some tingling down my arms. So I had tried everything prior to going through the surgery process, including cortisone injections, anti-inflammatory tablets. I had physical therapy and also an exercise physiologist who created a strengthening program just for my left shoulder so that I can build that strength around my shoulder. However, none of that actually worked and I had to go through the surgery process. So this is 4 months post shoulder surgery today, probably about give or take a few days. So anyway, I had an update with the surgeon, a follow-up, an appointment just a few days ago, and he was pretty happy with the amount of progress that I had made, particularly over the last 30 days. So in the last update that I gave you guys, which was at the 3-month mark, I had problems with being able to lift my arm up past shoulder height. So anything past 90 degrees, it would really bite on and feel like it's almost seizing or frozen at that point. So what he did was he gave me an increased amount of physical therapy that I had to follow, and also some anti-inflammatory tablets to take for 30 days straight. So over the past 30 days, I've really improved in the amount of strength and also mobility in that left shoulder. So in my last update, I could get it up to about 90 degrees before it would really start to bite on, and I wasn't able to lift it up much past that without excessive pain. At the moment, I can lift it up past that 90 degree mark, probably about up to here. So if you guys can see, I can really force that up, but it starts to get painful, bites on, and is a bit unstable. So like I said, I can really force that all the way up if I need to, but it's extremely painful at the moment and that range isn't there. So another thing, what I find is if I lift my arm up all the way, on the way down I have to bring it down really slow, otherwise it starts to kind of shake and it kind of skips on the way down. I think that's to do with the strength side of things. With regards to when I want to move my arm out to the side, so like I said, up to shoulder height isn't too bad. Once I extend my arm out to the side, that's when I really feel that weight, and then like you can see there, the shoulder's wanting to drop. So it becomes painful once I extend my arm out. So that's a lot to do with the strengthening side of things, but there's been a definite big recovery in that past 30 days, which has really improved. So I'm pretty happy with that. Another thing that I'm really worried about is because over the past year and a half or so, I've been experiencing pain in the left shoulder and also referred pain into that left side of my neck, which is very common. The problem is that it becomes a cycle. So when my left shoulder hurts, it ends up flaring up my neck and my neck starts to hurt. When the neck hurts, then it also flares up the shoulder and it becomes just a vicious cycle that's hard to break. Another thing that I've experienced is my right shoulder is starting to play up as well. So I've been experiencing that pain in the right shoulder, which is very similar to what was happening in the left, simply because I've been overusing my right shoulder to compensate for not being able to use my left shoulder. So it's kind of been a vicious cycle that I'm trying to get on top of, having treatment on the neck and also the shoulder. And I also went and got a scan, an x-ray and an ultrasound on the right side, which came up with bursitis tendonitis. So that was the same symptoms or same diagnosis that came up on the left shoulder initially. When they put itis on the back of something, it just means inflammation of that area. So tendonitis means inflammation of the tendons. Bursitis means inflammation of the bursa. The bursa is a fluid sac that's in your shoulder. So that's what I've been having lately. I've also got a referral for an MRI for my right shoulder to make sure everything's okay. Because I'm right hand dominant, I need to make sure that my right shoulder stays fine. I can afford for the left one to go, but not the right side. So I need to stay on top of that. It's kind of a cycle that I'm going through, but I need to stay on top of everything. So a common question that people have been asking is, why did I start physical therapy 6 weeks after my surgery? Very important question. It's a valid question. I've also asked that question to the surgeon at the early days of my surgery, and he said don't do anything for the first 6 weeks, just leave it in the sling. Now it's very, very alarming because I see a lot of people in the comment section below putting in there that they're starting physical therapy 1 week after their surgery, 2 weeks after their surgery. Now this really depends. I mean, the surgeon is the one that you need to take his advice. Don't listen to me with regards to that. Every surgery process is different and procedure is different. therefore the recovery is going to be different. When I did ask the surgeon, however, he gave me a perfect explanation, and I'm going to show you guys a quick demonstration as the best way that I understand it. But in basic terms, we had a tear in that left shoulder and that tear was open. So what they had to do was stitch it up, close everything back up, and that means that stitching or that area that's been stitched takes time to recover and heal. Now, if we had a scab or a little scratch on your hand somewhere, it's common sense. We can actually see that healing process, and it does take a couple of weeks for it to build up that scab, for the scab to drop off and everything come back to the way it's supposed to be. Now, on the inside, obviously it's not your skin. The recovery process is going to be longer and you can't see what's happening on the inside. So 6 weeks is in order to make sure that you don't re-tear that shoulder, because what tends to happen is you basically only get one shot at this. If you have that shoulder surgery and you damage it again, the chance of having a successful recovery is a lot less on the second time around than it is on the first time around. So what I'm going to show you guys is a quick demonstration using a piece of paper as to the best way to understand this. Alright guys, so using this piece of paper, I'm going to demonstrate why it's so important to look after your arm after surgery, and also why it's so unsuccessful the second time around if you happen to tear the stitches. So this circle here represents the labrum, or at least it's supposed to. In your shoulder, we've got a tear going down the middle. So you can see there, I just tore the paper. Anytime before having stitches done or having the repair done that you'd move that socket or move that labrum around, you can see it opens up there. That'll cause the instability in your shoulder and also the pain. So the surgeon's going to come along, they're going to stitch this section here back up, and it's going to look something like this. Probably a better job than what I've done. But anyway, so they're going to stitch this here up so that it can heal up as a normal stitch would. The problem is if you get on top of this too quickly and jump into physical therapy, what's going to happen is you've got a good chance of reopening this tear, because this section here hasn't healed. The only thing that's holding it together is the stitching. Now, if we went to the physical therapist, say after a week or two, and he starts manipulating my arm, obviously it's not strong, it's not held together yet, except for with the stitches. If they try to manipulate my arm, pull that through, they end up tearing the stitches over time. And you can see there what's happening is not only has the tear came out, but it's also tearing horizontally across the stitch as well. So I'll give this a bit more of a tear and I'll show you guys exactly what happens. So if we happen to re-injure this during those early stages, you run the risk of not only re-tearing that section again, it could tear almost all the way through as what's happened here. But the most important part is these horizontal sections where the stitches were held in. You can see now we've put tears down this also horizontally. So we've got that vertical tear and then the horizontal ones from the stitches. Now what happens is these stitches will eventually dissolve over time. So we'll remove this out and I'll show you what will happen. So this will be the damage in your shoulder if they went to go repair it the second time around. And you can imagine if they wanted to re-stitch this section here, even if they held it together and tried to get the stitching back through there, obviously they can't put the stitching back through the same holes, and it's going to be shredded all the way down. So that your chance of having a successful surgery second time around is very, very slim compared to the first time. So that is why the surgeon recommended that I wait 6 weeks opposed to getting straight into the physical therapy immediately. Now the rehab process with regards to physical therapy can be broken down into two sections: passive exercises and then active exercises. So what that means is passive exercises involves you doing nothing with your arm, not engaging the muscles. What you're going to do is you're going to just sit there and the physical therapist is going to do all the work. They'll take your arm, move it around and manipulate that so that they can get that range of motion back in your shoulder or in whatever part that you've damaged. So they're going to be doing all the work, and that's why it's called passive exercises. The next step after that is active or active assisted. What that means is you're going to either assist your arm. So I can take my right arm and kind of stretch that up and try and assist that arm in those movements. Few other movements involved in that include stretching. So that's also actively assisting your arm to get that strength and mobility back in there. We also use a broomstick. So just holding onto that broomstick and trying to really lift up your arms as far as you can go. We're using my right arm to take some of that weight on the broomstick and assisting my left arm to go up. Also, a few other exercises that I've been doing is with these bands. So these I knew that was going to happen. So with these exercise bands, doing rotator cuff exercises. The yellow band is what I started off with, move up to red, and now I'm on to green. So those external and internal rotations for the rotator cuff exercises. I've also been doing some dumbbell raises, so 1 kilo dumbbell raise with my shoulder, so just lifting it up like that. It's really helping build up that strength. I'm doing that right in front of my face, so coming up straight and also at 35 to 40 degree angle. So these are the exercises that I've been doing. I'm going to have a separate video later on with regards to the whole rehab process, so that you guys can look into that later on. Now, another common question that people have been asking me is what's the worst part of the surgery? So a lot of you out there might be considering that to go through the surgery process, or you're actually going through it now. If you asked me a couple months ago what the worst process or worst part of it was, I'd have to say the sleep. Because you become sleep deprived, you can't roll around on your shoulder, you're in pain, it's got referred pain, you're taking medication. If your night or your sleep is affected, your day also becomes affected. So when you're sleep deprived at night, it follows through into the day and it becomes another vicious cycle once again. So one of the important things is you need to get on top of your sleep or find a comfortable position to sleep in, because a lot of that recovery process happens while you're in your sleep. So you need to make sure you're getting on top of that. Guys, with regards to questions, make sure you put them in the comment section below, because it's not only for me. I'm not only able to answer some of those questions, I can also ask the surgeon those questions, and a lot of people are going through the same process. So we're here to help each other out. Put your questions and answers down in the comment section, help each other out. So with regards to me, like I said, back then I would have said the worst part is the sleep. Now I'd definitely say the recovery. It's a very, very slow process with regards to recovery, as you guys can tell. To get that strength and stability back is a very long process for me. The process is going to be different for everybody. That's another thing you got to take on board. Some people are, after a month, able to move their arm back almost the way they were beforehand. Some people at the 5 to 6 month mark can barely lift their arm like this and they're struggling. So it's really an individual kind of process with regards to the recovery. And with me, for example, I've never had surgery before. This is my first surgery, but generally speaking, I'm physically active, fit. I've always been like a mobile kind of person. And also with regards to my health, generally in good health. I very rarely get sick, but this recovery process is really, really slow, and I thought it'd be a lot faster because I'm generally healing pretty quick. But this one has been a very slow process. So for me and for everybody else, it's going to be a very individual kind of an experience. So the best advice that I can give you guys is, number one, everybody is different. This is so important. Don't listen to other people. Even myself, my experience might not necessarily be the same as your experience or your symptoms or the actual diagnosis of what's going on. So get on top of it as quick as possible. Check your scans, get your scans done, see with your specialist and your surgeon, get all your appointments done. They're the best ones that are going to be able to offer you whatever advice or opinions that you need from a medical perspective. So other people's experiences and opinions might not be necessarily what you need or what is best for you. So get on top of it quick, especially with these smaller tears in your shoulder. They can actually heal on their own if you get on top of it quickly, and you won't have to go through that surgery process. So follow your surgeon's advice or your specialist's advice, always number one and key. That's why I waited the 6 week mark. Other people might have a different plan that their specialist has recommended that might be tailored to them, but it might not work for you or for me. So guys, make sure you put all your comments down in the comment section. Ask any questions. Some people out there have the answers, and some people are actually going through the same process that we're going through now, and it's going to help everybody else out. So let's help everybody else out. Put everything in the comment section below. If I get a list of questions, I'll try and address them in a separate video whenever I get a chance. And another good thing is, if you're not satisfied with the opinion or what your surgeon has told you or the specialist has told you, it's always a good idea and has no harm in it to go and get a second opinion from another specialist. At the end of the day, these guys get paid to have the surgeries done, so it's always a good idea to get two opinions. That way you know the best option for you and what will work best for you. So guys, as always, like, comment and subscribe. Until next time, I'm Bill. Thanks for watching Training with Bill.